It's Elisa. I'm back, and we are talking about the blood vessels in circulation. This time we're going to talk a little bit about veins. Veins are the capacitance vessel. Basically, veins are going to pick up the runoff, the used up blood from the rest of the body. They're going to pull the waste everywhere from the lymphatic system to somewhat also in the tissues. They're going to take deoxygenated blood back up to the heart. And actually, let me just like make a pause on that. So like veins just deliver to the heart, okay? Remember this is going to be important because like systemic system, it's going to be like low oxygen blood, right? But in the pulmonary system, right? And so that means when the heart is actually, shunting blood like to and fro the lungs, right? Here's a like a lung, I guess. Um, it's going to be actually bringing in oxygenated blood because it's coming to, so pulmonary, it's like O2 rich blood. So there's just like a little caveat. It's this little detail. It's always like, we always love to ask that one on a test. Um, so the thing is like they're really floppy. And so I'll show you. So generally they have a steady blood flow, but they don't pulsate, right? They don't have like a muscular beat to them. They're kind of like, they're filling up their drainage. They're taking things back into the heart. And so it doesn't have a whole lot of pressure. Um, so here's kind of the distribution of blood. Most of the time, like you would say, that a lot of your blood is hanging out in your veins, right? A little bit's going through your heart, a little bit's going through your lungs, sorry, heart and lungs. Your arteries have really high pressure, and so they're like pumping it out into the tissues and into the veins. And so it's like there's just less of it. And the capillary bed's about 5% of the time because remember, they can kind of close off. And so if they're not being used, they can just like kind of throw it down. So the types of veins, there's a few. There's smaller veins, right? So there's larger veins like vena cava. Some people say vena cava. Either way, literally doesn't matter. But a venule is like a smaller version. Okay, so as we're like branching out and branching out, we tend to branch out into smaller and smaller versions, which we'll look at. So these are really porous, okay? And so their job is really getting some like fluid exchange around the tissues. The tunica interna, right? The internal component, right? So there's externa, media, and then interna, and that's where the lumen is. Only really has doesn't have a whole lot going on, but it has fibroblasts in it as well. Remember, veins generally don't have a lot of muscle for the most part. And the thing is one of the reasons this is so permeable is because we're able to get white blood cells into out of the bloodstream through these walls. Okay, so there are some, like I said, not really, mostly veins are not super muscular. They're not like, they're not aorta. But there are some that do have them. And so these are going to be the ones that are taking up blood from the postcapillary venules. They're not super huge, but they have one or two layers of smooth muscle. So it's like they have some. And of course, you will always find the muscle in the tunica media. Think media, think muscle, right? The medium veins also, right, for the most part, they're a little bit bigger and they have a thick external, and because mainly of the floppiness, right? If they're not really being used, they're a little bit fluffy. But that's because if they need, if they all of a sudden have like higher pressure, they can really like expand quite a bit. So it kind of allows for that in a bit. The neat part about veins, which I just love, is like you get valves in veins, right? And this is like literally a sideways vein in I thought, let me get the better cut. Okay, here we go. There we go. It's like two little flaps that meet kind of in the middle, right? And here's a closed valve and here's an open valve, right? And so like blood is going through the open valve and then blood is not going through this. But you know what? The point is it's not also going backwards. It doesn't go backwards. And that's the point of a valve. It like kind of like it's like the Panama Canal. It's like a system of locks that gets it back up to the heart because your heart's actually kind of far up there. And these low pressure veins, you kind of have to create a pressure system. And so that's kind of what that does. So when we're talking about veins and venous valves, and especially tunica externa, we're looking at the concept of varicose veins, which is kind of this big deal in humans because we super get them. Right. So they can form from failure of valves, and sometimes that failure of valve is because the tunica externa is actually just really like stretched out, if that makes sense. There's been a lot of pressure. Let me see if I can get a picture of there. Okay, so like here's an example of like a varicose vein. And so these veins have collapsed on themselves. And so what's happened is they've had a lot of irregular pressure. Or, people could have connective tissue disorders and then it just makes the tunica externa really like prone to being like more flexible and not returning to its state. So kind of has that like stretching outingness. Um, the valve system typically is intended to keep veins like relatively like in this shape where you don't have to worry super much about these squiggles. And the reason that varicose veins can be a major issue, and I know some people say they're cosmetic, but like really it's important. So we have these broken valves, so we don't have good blood pressure. We have the chance the blood is actually going to pool quite a bit down, especially lower extremities. So remember, get off your feet, put your feet up in the air, raise them up high. And if you work out a lot, cardio, you will actually, your body will put in more of these valves and actually strengthen some of this area even more. But anyway, so the varicose veins have this secondary issue that like little clots can form, like on these broken valve areas, right? And so it just like this blood just can't get out from behind the valve. And so that can further cause issues. And then when you already have kind of compromised veins, it's not like it's going to get better. These are weakened veins. So some folks can opt to have some surgeries. Like there's a lot of options out there. But it's just very important that if you see individuals who, especially in our society, I will say that a lot of folks tend to, instead of talking to their vascular specialists, especially their vein doctors, they will hide this and say it's cosmetic, it runs in the family, it's not a big deal. And to some extent, that might be true. But to some extent, it could be very dangerous and it could be possibly a very simple procedure to correct. And I think, always early intervention. So help your cardiovascular system have less clots and be healthy is always priority. So if it's a possibility, check into it. And prevention, again, pressurized socks, putting your feet up, like getting a strong heart, and knowing whether or not you are prone to varicose veins. Like some folks might have a propensity towards that, and they are a very good deal. Okay, so right, so I wanted to talk about those. So I think we were in the, hold on, there we go. Yeah, venous sinuses are especially thin-walled. They have very big lumens, right? And you can just really get through. They don't have any muscle at all. They're really just like soaky type things. They're really in there for the soaking. And so these are going to include dural sinuses, coronary sinuses. So if you remember, like in the heart, like the dural, like the, I'm sorry, the coronary sinus, like kind of wraps around. And here's these like veins that come off of it, but then it gets it's like kind of bigger right here, right? So that's kind of what you're thinking of. Like anytime you see a sinus, like think of it as being large. It's not like an aneurysm, but it's not small compared to the other veins around it. Um, the smaller ones. So large veins are considered to be anything that's more than like 10 millimeters in diameter, which is still tiny. Relative to a lot of things, I guess. In my mind, I just think a lot of very small veins out there. So smooth muscle in all three tunics. So they are actually very, they have a lot of ability to be more mobile. However, the tunica media, which is usually where the biggest muscle layer is, say in our arteries, is kind of on the thinner side. So there's that. And so the smooth muscle, right? It does a few things. It just like um, it works to create peristalsis, right? And so here's like relaxed and then contracted, they just kind of bunch up together and they just make that surface area smaller, right? So that's what they're doing. The tunica externa is the thickest layer in this one. They do contain smooth muscle, but in this case, it's like more longitudinal ones. So vena cava, pulmonary veins, internal jugular veins, and the renal veins. These are like kind of monster veins themselves. We talked a little bit about varicose veins, so pooling of the blood. The cusp of the valves can pull apart, right? So, normally you want your flaps to go like this and close that door. But what happens is they like don't like close entirely anymore or like, at all, like maybe one's going to, so this is kind of the problem. You get backflows of blood, which is a compounding issue, as well as clots that can form also right behind and tissue damage as well. And then some folks can inherit it. It is prone, like lifestyle obesity, right? Lack of cardiovascular exercise, and then pregnancy. Oh my goodness, rapid weight gain and like increasing blood. Oops, no, we don't want to drain the hotspot. Can really increase it as well. So get those legs up, keep that heart strong. Hemorrhoids are the varicose veins of the anal canal, and there is surgery for that as well. Um, okay, and I think that was kind of it. All right, well, I hope that was super helpful, and I hope you are able to have a wonderful day. Bye bye.